friends, welcome to Raja Nursing Education. In this video, we are going to discuss about defibrillation. What is defibrillation? As a nurse, if you are a health worker, you all are very well know about the defibrillator. It's a device which used in case of cardiac arrest to deliver a shock to the patient to restore the normal heart rhythm. Here, only main two conditions we can use the defibrillation. One is the ventricular tachycardia and the another one is the ventricular fibrillation. Only in two rhythms we can use the defibrillation. Especially in cardiac arrest, first what we have to do, we have to check for the carotid pulse, whether patient is having a pulse or not. Then we have to bring a defibrillator and we have to connect that 3-lead defibrillator. In defibrillator, you can analyze the rhythm. If the patient is in VF or VT, it means we have to deliver a shock to the patient. To deliver a shock, we have to follow some steps before doing defibrillation. Let's know what are the steps you have to be follow in case of defibrillation. First, we have to switch on the defibrillator. Then we have to connect the 3-lead ECG to the patients. Then you have to analyze the rhythm in ECG. We have to check whether it is a VT or VF for patient in bradycardia or SVT. If the patient is in bradycardia or pulseless rhythm, means there is a AF. In such conditions, we should not defibrillate the patient. Only in VT and VF, means ventricular tachycardia and ventricular fibrillation. Many of them have doubts. How much joules you have to select for to deliver a shock? If you are a new nurse, you don't know how much joules you have to select. Just you can go with 150 or 200. Suppose if you have a doctors and medical teams are with you, they will decide how much shock they have to deliver to the patient. It depends upon the patient, body weight and age. In the defibrillator, we have two types of paddles. One is the adult paddle and pediatric paddle. If you are delivering a shock to the adult, we can use the adult paddle. Behind the adult paddle, you can see a pediatric paddles, which we can use only in case of pediatrics. Before delivering shock, we have to apply a gel to the paddles. Why means it acts as a good conductor and it will deliver a shock properly. If you are applying it without a gel, it will cause a burn injury to the patient. If the patient is having more hair, it's better to we have to shave the hair before delivering a shock. And we have to place one paddle over the right sternum of the chest and the other paddle on the apex of the chest. So now first we have to switch on the defibrillator. The next step is we have to connect the 3-lead ECG to the patient. Then you will find a rhythm in the ECG strip. If the patient is in VT, you have to deliver a shock. But before delivering a shock, I told you we have to follow some steps. Let's see what are the steps we have to be follow before delivering a shock. The first step is we have to switch on the defibrillator, connect 3-lead ECG to the patient. You will find a ECG rhythm on defibrillator. If it is a VT or VF, means the patient we have to deliver a shock. Before delivering a shock, we have to select a joules. There will be a joule button. We have to select a joules, whether 50, 100, 150, 200 like that. But the doctors will be decide based on the patient weight. If it is a pediatric, the dose will be a different. If there is adult, the joules dose will be a different. After selecting a joules, we have to press the charge button. Then only the defibrillator will charge. Then we have to press the shock button. There will be a 2 shock buttons on the both the paddles. We have to press it simultaneously. But here, while many of them they will go and give directly shock to the patient without any instructions. It is a completely wrong method. So before delivering a shock, we have to check whether your floor is wet or dry. If you are standing on the wet floor, don't deliver a shock because you will get electric shock from the device. And the next thing is, if the patient is on oxygen, we have to turn off the oxygen because oxygen is a flammable. It will easily catch a fire. And before delivering a shock, you have to give some instructions like, I am clear, you clear, everyone clear. Then you have to deliver a shock. There should not be any contact between the bed and you. Always you have to stand 1 feet away from the patient and to deliver a shock. These are the steps you have to be follow. If you like this video, Please like, share and subscribe. Thank you. Meet you next video.